I am Reza Sabetghadam, an occupational physician consultant. And the area of interest which I work in these days are mostly musculoskeletal injury management and independent medical examination for causality of the injuries and discussion about the fitness for work of employees. My specialty of occupational medicine talk about effect of work on health and health on work in simple language. And this is the way we train to assess people's ability to work, the impact of work on their health, and the impact of their health on their work. When I assess someone with this point of view, I could help a case manager, employer, or employee to better understand the correlation or connection between the health issues and his or her work ability. I was in emergency department of a hospital one day and I realized how much correlation or interaction is between our health issues and our work. Majority of every modern life human being time spent in his work on day-to-day basis. Some people are 8, some people 7, some people 12, and therefore it's important to look at the way their health affects their working condition, work and working condition, and vice versa. This made me interested in occupational medicine, and the most important aspect of my job I found it in occupational medicine. We have somehow like public health or epidemiology have more reliance on scientific approach on health issues rather than on personal experiences. And this was the most interesting part of my specialty, I guess. I see majority of work-related injuries and health conditions. This could be a very broad spectrum, could be musculoskeletal injuries, could be, for example, lung conditions, could be toxicities. And every condition which could be caused by workplace, work and work environment, or somehow there is a contribution of the work in this health issue. I see them and I assess them, and I discuss about the causality of the medical conditions, what is caused with the work or impacted by work. And also I have a great deal of interest in providing evidence-based treatment approach for medical conditions could be impacted by work. And I use always scientific data from a variety of sources. In the last 12 years of my experience in occupational medicine, I have seen workers and employers from a variety of industries, from governmental organizations and departments in regards to their fitness for work and injuries related to work, to emergency services such as firefighters, ambulance officers, and the police force. I have seen workers in construction sites, in mining sites, or production lines. And I worked in a variety of industries, including emergency services as a medical officer, in mining industry as a medical officer, and also, even I worked there for a short period of time in gaming industry for workers who work in gaming industry as a medical officer, and I manage their injuries and work-related conditions. I use always scientific pool data to reach my conclusion. I don't rely only on my personal experience, because I believe the scientific approach to any medical condition is the best approach, and my opinion is always rely on the evidence in medical literature. And in this way, in my clinical opinion, we could do the best treatment management plan for injured worker or a diagnosis of medical conditions or correlation of these conditions with employees' work environment. Well, the impression I expect the injured worker to take from my assessment or management is, first of all, to feel safe in my clinical rooms, and second, feels respected, and the third is feels the doctor cared about me and didn't treat me as an injury and treated me as a person. Because from my point of view, a person is not injury, is a whole person, and whole dynamic of his life is could be influenced by the particular injury or particular disease, and this is very important for me to portray that picture of myself to the examinee. This doctor understood me and paid attention to the details, because details of history are very important. Honestly, I'm just hoping we could get the best care and what is best for the patient. The reason for that, that was actually main drive took me to this role. I always realized some of these examinees and patients throughout this claim process or injury process gone through a huge amount of stress and difficulties which affected them life in different ways, and I always believed this actually the work injury or a medical condition, it looks like a building, and a doctor who assesses the person for first time after the accident or injury puts the cornerstone of this building, and if he puts the cornerstone in the right spot, this person will recover from the condition, returns to work, or enjoys his life. And if this cornerstone put in wrong spot, unfortunately the whole process of this building will go in the wrong direction and affects the person's life in so many levels, in regards to disability, in regards to personal and social interactions. My hope is one day all of us, all of the experts in this industry have a scientific approach to injured worker or any management of health conditions related to work, in order to be able to help people and avoid the litigation process for a very long period, because this could affect, honestly, the personal and social life of a person significantly. I'm hoping one day we achieve this. This is my dream and goal.